Kelly. I'm 40 years old. I'm originally from the Netherlands and I came to King's College Hospital for a spinal cord stimulator surgery. My back pain issues started from the age of 16 and they found out that I had a bulging disc, but I was too young for surgery. Say for 20 years I suffered with pain. The surgeries were not working, the pain was not getting less, it became worse. Then when we moved to Dubai, I thought I will give it a new try, and then I came with Dr. Nicandro, and then he saw the issues in my spine and he sent me to Dr. El Toukhy.
I met Kelly 3 years ago in my pain clinic when she presented with severe back pain and bilateral leg pain. Kelly had almost 3 surgeries before we met. Unfortunately, she was always in pain, even with surgery.
When I came to Dr. El Toukhy, he was explaining me everything about the spinal cord stimulator. He also invited the people from the company from the spinal cord stimulator to explain me everything in detail about the device itself.
Spinal cord stimulation is a new technology that uses electric waves which interrupt with a painful signal from the back up to the brain.
The spinal cord stimulation usually use a trial first, in which we insert thin leads which can stimulate the spinal cord and block the pain passage. We connect these leads to an external battery which stay in the patient only for 3 or 4 days. And if the patient likes the result, then we take it out and plan the permanent insertion of the spinal cord stimulator device.
And I felt really comfortable because I could ask him anything. And then I had a 2-week trial. So they planned the device, but only on the outside and the leads on the inside. And after a couple of days during the trial, it was gone. This device really works.
It has the beauty of being able to have a trial first. The patient can undergo an initial trial for a week to 2 weeks when they can test the treatment before they go for the full implant.
I think after 1.5 years, I thought, okay, I'm feeling really good. I went back to the gym. I started with my exercises, didn't do for a really long time because I was always in pain.
I do remember that Kelly had almost 100% relief of her pain, and that was felt after the first few days. The surgery includes implanting the battery, the electrodes in the spine, which took like 1 hour procedure. The recovery was very quick, only 1 day of hospital stay, and then she was able to go home. So the spinal cord stimulator can be useful for treatment of many conditions, including failed back surgery syndrome, when patients have had surgery for the spine and they're still in pain, resistant painful conditions like post-herpetic neuralgia, or patient with CRPS, which is a painful limb after surgery, diabetic neuropathies, when they do suffer with chronic painful conditions in their legs that has not responded to medical management. Recently, there have been studies on using it as well for angina patients who have refractory angina despite medical management. So these are the indications for spinal cord stimulation.
Spinal cord stimulation came as an old concept in neuroscience, but the technology and the equipment are evolving quite significantly, especially in the last few years. Instead of only numb the limb or the area, it's really blocking the pain in a very efficient way. So spinal cord stimulation is essentially a multidisciplinary procedure which involves the neurosurgeon and the pain physician with the whole team of the hospital, including physiotherapists. Spinal cord stimulation has been proven as a very efficient treatment for those cases of chronic pain, and instead of keep repeating some kind of surgeries, which sometimes are not really helpful, we can add this possible technology to minimize the suffering of those patients with chronic pain. So Kelly had a very good result. She returned to her regular activities and having a happy life. She just doing the follow-up with us, and we continue this for the next several years.
Well, I want to say thank you to Dr. Nicandro to send me to Dr. El Toukhy. The both of them, they were amazing because they are one team. They did the surgery together, they did the checkups together. Yeah, a big thankful for them.